In your own words, can you describe the current state of the market for American healthcare? What are some factors that are beneficial to patients and physicians? And what are some of the challenges?
I think that's a really great way to put it because you always have the danger of kind of oversimplifying, right? I think um, we're at we're at a really important point here. I think I've probably said that every year in the past 5 years because the marketplace has changed so dramatically, right? Consolidation has been occurring for over a decade, but we are at a point now where large corporate entities are truly in charge of the healthcare system, and their influence is being felt in ways that we've not really seen until recently. So for the longest time, consolidation really was horizontal, as we say. It was physicians would merge with other physician groups and hospitals would merge together. And yes, they were growing, right? Insurers were merging into larger insurers, but they were staying kind of in their own lanes. And now what we're seeing is an incredible amount of vertical integration where you have entities in different kind of lines of the ecosystem, points of the ecosystem, purchasing other, points. So you have insurers that now own physician practices. You have hospitals, of course, having employed, huge numbers of doctors, and buying those practices, and not to mention all of the integration with pharmacies and nursing homes and the whole system, right? And so I think we're feeling an unprecedented amount of corporatization, we say, of the system, where you have corporate entities that have policies that really, for the first time in the history of medicine, are impacting how physicians practice medicine. And we're really at the beginning of that, I would say, really early stages still, but we're seeing it's being felt. And so when, for instance, a private equity firm buys a physician practice, as the employer, as the business entity that has a very clear strategy of consolidating like practices together, rolling them up, cutting administrative costs, aggressively marketing, maybe cutting staff, cutting clinical staff, changing the practice environment, that affects physicians, which we're concerned about. But more importantly, it can really affect patients. And so we need to pay close attention to how all of that is playing out, how this corporate influence, right, and the policies that you see that go along with that, with any employer, right? Any employer is going to affect, the work of their employees. And to think that that's not happening in healthcare is delusional. It's happening.